Okay, so on the topic of tailbone pain, we have a patient here who's agreed to be our model while I talk to you a little bit about what we can do to help. So this is, if she's laying flat, this is looking at the back of a pelvis. So as far as tailbone goes, a lot of people call their tailbone this whole triangular bone at the bottom of the spine here. This is actually called your sacrum, and so it's right here. And your tailbone's at the very tip of that. So we're looking down around mid glute, but like very central. Tailbone pain is common after a slip or a fall in people with degenerative conditions of their low back, but also really popular before, during, and after pregnancy. So I want to show you a little bit of how I assess what's going on and also how it can be helped. We'll also share a testimonial that someone gave recently about how they were really helped in a matter of just a few visits. Their pain has significantly decreased. So essentially, if the tailbone and sacrum are tilted in any direction, or if there's tightening of muscles surrounding this area, or a lot of pressure on ligaments. So she's pretty far along and is feeling a lot of that downward pressure in her pelvis. So that can also press on things and cause discomfort. So I'm going to do several things, which I already did today, to assess how the pelvis is tilted or twisted. She's actually tilted high up on her left side, and her sacrum is tilted anteriorly on that side. So I'm going to come right up under a ligament in her pelvis that attaches to the front of her sacrum and down here on her ischial tuberosity, or like her sits bone. And I'm going to just do a light contact there. So this is especially for women who are pregnant or have been in the past. This is not the most intimate contact you're going to be receiving because, as you know, you lose some modesty through the process. But for anyone who is not in that stage of life, it's also just on the glute. It's very comfortable, very non-invasive. And then we just kind of rock the sacrum back into place, and we're lifting up on that ligament to create space within the pelvis. This allows the muscles to relax, the bones to align. And if you think about the abdominal cavity, and especially when you're pregnant, the womb needing to have lots of extra space. If there's something that is tight on one side or twisted, the baby has less room to lay comfortably in that space. So we want to check the round ligaments in the front here, and we do have some tension in the front here, so this is something we'll be doing some light pressure and work on. You can also do this yourself at home. But then we want to just lift up on this ligament as well, and it actually can really start a nice relaxation cascade throughout the whole back. So that's one of the most common ways of treating pregnant women, especially through the Webster technique, which is designed specifically for pregnancy. But this technique is also, this contact here is called Logan Basic technique, which is really good for tailbone pain and chronic low back pain as well. You're going to find tension in the erectors here. The erectors are those muscles that run along the spine and give you stability. So big fancy words, showing you a technique so that if you're sitting at home with tailbone pain wondering, who do I get to look at this? Is it gonna be weird? Will it even help? How long will it take? Etc. You can really have a lot of relief even after one treatment of this if your doctor is skilled and knows that these are the contacts and techniques to use. They're very gentle, they're very safe for all populations, and you can really have a really nice lasting effect. So we're going to share a testimonial of someone who recently was really helped with their tailbone pain, but we've got more people who have been helped by this too. So just let us know if you're looking for a doctor in your area, or we'd love to meet you if you're local to the Cleveland area and could come in and get some treatment for this pain. I hate when I hear that people are just not sure of where to go. And they just don't know where to start. So certainly start here, and we would be happy to help you out, or leave a comment in the comment section, and I'd be glad to talk to you about your specific condition. All right, I think that sums it up. Thanks.